Are you concerned about maintaining healthy bones and preventing osteoporosis? Look no further than the powerful combination of calcium and vitamin D. These essential nutrients play a vital role in maintaining bone health and preventing diseases like osteoporosis. Calcium is the building block of our bones, and it is crucial for maintaining their strength and density. However, our bodies cannot produce calcium on their own, so it is necessary to consume it through our diet or supplements. Vitamin D, on the other hand, helps our bodies absorb calcium more efficiently. Without enough vitamin D, our bones may become weak, fragile, and more susceptible to fractures. Incorporating calcium-rich foods such as dairy products, leafy greens, and fortified foods into your diet, along with getting enough sunlight to boost your vitamin D levels, can help you maintain strong bones and prevent osteoporosis. The importance of calcium and vitamin D for bone health. Calcium and vitamin D are essential for maintaining optimal bone health throughout our lives. Calcium is necessary for the development and maintenance of strong bones and teeth. It is also involved in various bodily functions, including muscle contractions and nerve signals. Vitamin D plays a crucial role in helping our bodies absorb calcium from the foods we eat. Without sufficient vitamin D, our bodies cannot effectively utilize the calcium we consume. As a result, our bones may not receive the necessary amounts of calcium, leading to weaker bones and an increased risk of fractures. Both calcium and vitamin D work synergistically to support bone health. While calcium provides the structural framework for bones, vitamin D ensures that calcium is efficiently absorbed and utilized by the body. Therefore, it is essential to maintain adequate levels of both nutrients to promote strong and healthy bones. Understanding osteoporosis and its risk factors. Osteoporosis is a condition characterized by a decrease in bone density, making bones weak and more prone to fractures. It is often referred to as the silent disease because it progresses slowly over time without any noticeable symptoms until a fracture occurs. Several factors contribute to the development of osteoporosis, including age, gender, genetics, hormonal changes, and lifestyle choices. Women, especially after menopause, are at a higher risk of developing osteoporosis due to the decline in estrogen levels, which plays a protective role in maintaining bone density. Additionally, individuals with a family history of osteoporosis, a sedentary lifestyle, smoking habits, excessive alcohol consumption, and a diet low in calcium and vitamin D are also more susceptible to the disease. Recommended daily intake of calcium and vitamin D. To maintain optimal bone health, it is important to ensure an adequate intake of calcium and vitamin D. The recommended daily intake varies depending on age, gender, and life stage. For most adults aged 1950, the recommended daily calcium intake is around 1,000 milligrams. Women over 50 and men over 70 should aim for 1,200 milligrams of calcium per day. As for vitamin D, the recommended daily intake for most adults is 600-800 U international units. However, individuals with limited sun exposure or other risk factors may require higher doses. It is worth noting that these recommendations may vary based on specific health conditions or individual needs. It is always advisable to consult with a healthcare professional to determine the appropriate intake of calcium and vitamin D for your specific situation. Natural food sources of calcium and vitamin D. Incorporate Incorporating calcium-rich foods into your diet is an effective way to meet your daily calcium requirements. Dairy products such as milk, cheese, and yogurt are excellent sources of calcium. However, if you are lactose intolerant or follow a plant-based diet, there are plenty of non-dairy alternatives available. Examples include fortified plant-based milks, tofu, almonds, sesame seeds, and leafy greens like kale and broccoli. Similarly, obtaining vitamin D through natural food sources can be challenging, as there are limited dietary options that provide adequate amounts. Fatty fish like salmon, mackerel, and sardines are among the few natural sources of vitamin D. Additionally, egg yolks, fortified dairy products, and certain mushrooms contain small amounts of vitamin D. However, it can be difficult to rely solely on food sources for meeting your vitamin D needs, especially if you have limited sun exposure. Supplementation options for calcium and vitamin D. If it is challenging to meet your calcium and vitamin D needs through diet alone, supplementation can be a convenient and effective option. Calcium supplements are available in various forms, such as calcium carbonate and calcium citrate. It is important to choose a supplement that is easily absorbed by the body. Vitamin D supplements are commonly available as vitamin D3 and can be taken orally. When considering supplementation, it is essential to consult with a healthcare professional to determine the appropriate dosage based on your specific needs. They can also help identify any potential interactions with other medications you may be taking. The role of exercise in maintaining strong bones. In addition to adequate calcium and vitamin D intake, regular exercise is crucial for maintaining strong and healthy bones. Weight-bearing exercises, such as walking, jogging, dancing, and weightlifting, help stimulate bone remodeling, leading to increased bone density and strength. Engaging in resistance exercises, such as using resistance bands or lifting weights, can also be beneficial for bone health. These activities increase muscle strength, which indirectly helps support bone health. Incorporating balance exercises, such as yoga or Tai Chi, can improve stability and reduce the risk of falls, which is particularly important for older adults. It is important to choose activities that you enjoy and can incorporate into your daily routine. Aim for at least 30 minutes of moderate intensity exercise most days of the week to reap the benefits for your bones and overall health. Lifestyle factors that affect bone health. In addition to diet and exercise, certain lifestyle factors can significantly impact bone health. Smoking, excessive alcohol consumption, and a sedentary lifestyle have been associated with decreased bone density and an increased risk of osteoporosis. Smoking has been shown to accelerate bone loss, reduce bone mass, and impair fracture healing. Quitting smoking can have numerous health benefits, including improved bone health. Excessive alcohol consumption can also negatively impact bone health by interfering with the body's ability to absorb calcium and impairing bone formation. Limiting alcohol intake to moderate levels, up to 1 drink per day for women and up to 2 drinks per day for men, is recommended for overall health and bone health. Maintaining a healthy weight is another important factor in bone health. Both being underweight and overweight can increase the risk of developing osteoporosis. Strive to maintain a balanced diet and engage in regular physical activity to achieve and maintain a healthy weight. Common myths and misconceptions about calcium and vitamin D. There are several common myths and misconceptions surrounding calcium and vitamin D. One myth is that consuming large amounts of calcium and vitamin D will automatically result in stronger bones. While it is essential to meet the recommended daily intake, excessive intake does not provide additional benefits and may even have adverse effects on health. Another misconception is that dairy is the only source of calcium. While dairy products are excellent sources of calcium, there are plenty of other options available for those who are lactose intolerant or follow a plant-based diet. As mentioned earlier, leafy greens, fortified foods, and various other plant-based sources can provide adequate calcium. Similarly, many people believe that spending excessive time in the sun is the only way to obtain vitamin D. While sunlight is an important source of vitamin D, it is essential to balance sun exposure with protection against harmful UV rays. Additionally, individuals with limited sun exposure or specific risk factors may require vitamin D supplementation, as it can be challenging to obtain sufficient amounts through diet alone. Osteoporosis prevention strategies for different age groups. Preventing osteoporosis should be a priority at all stages of life. Building strong bones during childhood and adolescence is crucial for reducing the risk of fractures later in life. Parents should encourage their children to engage in regular physical activity, consume a balanced diet rich in calcium and vitamin D, and limit the intake of sugary drinks and excessive caffeine. During adulthood, it is important to maintain a healthy lifestyle that includes regular exercise, a calcium-rich diet, and adequate vitamin D intake. Women going through menopause should discuss hormone replacement therapy and other treatment options with their healthcare provider to minimize bone loss. Older adults should prioritize fall prevention strategies, such as removing hazards at home, using assistive devices, and practicing balance exercises. Regular bone density screenings can help identify individuals at a higher risk of osteoporosis and guide appropriate interventions. Conclusion. Taking control of your bone health. Maintaining strong bones and preventing osteoporosis is a lifelong commitment. Calcium and vitamin D play a crucial role in supporting bone health, and incorporating them into your diet is essential. By consuming calcium-rich foods, getting enough sunlight, and considering supplements when necessary, you can give your bones the support they need. Regular exercise, maintaining a healthy weight, and making wise lifestyle choices also contribute to optimal bone health. By understanding the risk factors and prevention strategies for osteoporosis, you can take control of your bone health and reduce the likelihood of fractures and other complications. Remember to consult with a healthcare professional for personalized advice and guidance. Thanks for watching.